In this video, I will tell you about 10 reasons why, despite being on a keto diet, your belly size is not reducing. You may not be following the plan correctly. Many people I talk to often base their diet on just one video they watched and try to follow the keto diet, but they don't do it properly. You need to reduce your carbohydrate intake to below 50 grams. Start with 50 grams and gradually bring it down to 20 to 30 grams per day. There is very little room for eating bread or rice. Try to get your carbohydrates from vegetables, which you can steam, boil, or grill. Along with this, you need to take protein. If you go to the gym, consume at least 1 gram of protein per kilogram of body weight, and if you don't, then also take 1 gram per kilogram of body weight. To simplify, you can take protein from eggs, chicken, fish, or beef. If your weight is 80 kilograms and you don't go to the gym, you should still consume at least 80 grams of protein daily. Regarding fat intake, in the beginning, you should consume more fat to keep yourself full because you have given up bread and carbohydrates. This helps in preventing hunger between meals. Healthy fat options include desi ghee, butter, olive oil, nuts, cheese, and animal fat, meaning cook your meat in its own fat. However, as you progress in the keto diet, you need to gradually reduce your fat intake because in keto, we want the body to burn its own fat instead of relying only on the fat we eat. By reducing dietary fat, the body will start using its stored fat for energy. Another reason for not losing belly fat could be that you are not doing intermittent fasting along with keto. If you want to lose fat quickly, just doing keto is not enough. Every time you eat, insulin is triggered, and fat loss stops in the presence of insulin. In fasting, since you are not eating frequently, insulin levels remain stable, allowing fat loss to continue. By fasting, you can speed up the fat-burning process, and this happens only when insulin remains stable. Sometimes keto is working, but you feel like it's not because, at the start, weight drops quickly, but then it slows down, making you think it has stopped working. Initially, you might lose 2 to 3 kilograms per week, and you get used to that speed, but then when you lose less than 1 kilogram per week, you feel discouraged. But this is the reality. A healthy person can safely lose up to 1 kilogram per week without harming their health. This is the natural process. If you are losing even half a kilogram per week, it means your diet is working. Instead of just focusing on weight, check other indicators like increased energy, better sleep, improved focus, and reduced inflammation. These are signs that the diet is working, even if belly fat is not decreasing rapidly. If you have fatty liver, that could be another reason. When the liver has excess fat, it struggles to produce ketones, and growth hormone slows down, which reduces fat loss speed. You need to improve your liver health by taking choline and B vitamins. Initially, the body eliminates visceral fat around the liver before focusing on belly fat. So even if you don't see a reduction in belly size, your body is still burning fat. Stay consistent with the program. If your muscle mass is increasing, this could be another reason why your belly size is not decreasing. For females going through menopause, muscle mass naturally shrinks, a process called muscle atrophy. If you feel difficulty standing up from a chair, it may indicate weak thigh muscles. With a healthy diet and good nutrition, you may not notice belly fat reduction immediately, but you are getting stronger from the inside. Muscle atrophy reverses, and new muscle fibers may form, but this is a long process that can take 1 to 2 years. Exercise is necessary, and diet must be maintained. You might not be exercising properly or not at all. Exercise increases growth hormone, tones muscles, and helps with weight loss. Full-body workouts are ideal, but if you can't go to the gym, at least walk. If knee pain is an issue, you can cycle or use a stationary bike at home. Health conditions like thyroid problems, hormonal imbalances, or heart issues can slow down weight loss. Sometimes the body focuses on healing other health issues before it starts losing weight. Identify your weakest link, whether it's thyroid, adrenal glands, or any other health problem, and work on that first. The goal is first to become healthy and then lose weight. Medications can also be a reason. If you are taking a lot of medicines like cholesterol-lowering statins or antidepressants, these can slow down weight loss. Some of these drugs cause insulin resistance, raising insulin levels, which prevents fat burning. You should consult your doctor to find natural alternatives and gradually reduce dependency on medicines. If your blood test results are normal but your doctor still prescribes medication, you might want to seek a second opinion. Stress and lack of sleep also play a role. If you improve your sleep without making any other changes, your weight will start dropping rapidly. You will be surprised at how much of a difference good sleep can make. Identify which of these reasons applies to you and focus on improving that area. Take care and goodbye.